So we have placed only unilateral pterygoid. We have avoided pterygoid on the right side. This is the left side pterygoid. 3.75 into 16. This implant is the nasomaxillary buttress implant. You can see the implant is starting from the palatal aspect and it is close towards the labial aspect near the apex. This is 4.216 bioline. This is 3.75 into 18, getting engagement in the nasal floor. This is also 3.75 into 18 into the nasal floor. This is also 3.75 into 18, contacting the nasal floor. This is nasomaxillary buttress implant. Okay. This is 4.2 into 18. We have avoided pterygoid on the right side. The reason being is the point of implant exit is almost in the first molar area, so there is no need for pterygoid this side. Okay. If you see closely, this is the buttress, the zygomatic buttress. So that area corresponds to the first molar. So the implant here is near the zygomatic buttress, but this side it is near the first premolar area. So we have placed a pterygoid here.